Now, we've seen a surge in new infections here in France and elsewhere in Europe recently. How is this wave different to the one which crippled the continent earlier this year? And is it just youngsters that are sparking a rise in numbers?
Yes, you're right to say that it is a very different epidemiological situation from the one we have known in March or April, because first of all, as you mentioned, it's mostly young people who are attacked before 40 years. And there is a very different profile of mortality. If you see the mortality curve, it is still very, very low. So there is a kind of paradoxical situation with a coronavirus, which is no more deadly because it attacked primarily the young people and is not so severe in this class of age, as you know. What we don't know is why it does not spill over, if I can say that, to the elderly people.
Now, much has been made here in France about whether the wearing of masks should be made compulsory and in which specific areas. What's your view on the need for this protection?
You know, the mask is one of the best protection against these coronaviruses, waiting for probably better tools such as vaccines or drugs. But for the moment, without any drugs, we have the mask, protective mask, we have the hand washing, and we have the home office, if I can say that. So using mask in every closed area is very, very important because it's poorly ventilated, because most of the clusters comes from these closed areas where they are, of course, a bit crowded. Outdoors, I would not say it is such an issue because we don't know any report of major clusters which occurred outdoors. So I'm not so sure that it is very useful outdoors, maybe with some exception if you are very crowded in some streets, packed street like in Saint-Malo or elsewhere, maybe it could be worse wearing this mask because you cannot have the physical distance of 1.5 or 2 meters between people.
And finally, the UK has been heavily criticised for trying to curb the spread of the virus by imposing quarantines on those travellers returning from certain European destinations. How can governments best deal with this virus during this busy time when people want to travel and relax?
It's not completely absurd to think that some viruses may come from abroad if the epidemiology abroad is very different from that one you experience in your country. And currently, we have to acknowledge the fact that in the Great Britain, in the UK, the epidemiology is very low, even in terms of transmission. So they may, because France, because Switzerland, because the Netherlands, because Denmark and Spain also are a bit red in terms of the circulation of the virus, we can imagine that they want to protect themselves by filtering a bit more, by quarantining the people coming from this risk zone for them.